him, he used to say, I'm here to be an ambassador for good erections. And so that's what I'm here for. I get guys in my office all the time that I talk to about erectile dysfunction. I bring this issue up. We discuss the issue very openly. I have some guys that they want to talk about it, and I will point blankly ask them, do you have problems with your erections? And they're like, no. And so, fine. And this goes on 3 or 4 or 5 years, and they've come to me and I say, what brings you in, Dave? I got to get my erections fixed. When did this start? Well, about 4 years ago. It's like, I've been asking you this every year. Well, okay, doc, it's fine. And so every patient, you got to kind of figure what their comfort level is with discussing this. But I want to sort of touch on erectile dysfunction. I know with the advent of drugs like Viagra, Cialis, Levitra, the direct-to-marketer consuming the advertisements you see with the Jay Lenos and the David Lettermans, it's become quite the topic of television. A lot of it is good information. A lot of it is bad information. I will tell you that when I was a resident medical student, we had basically only for erectile dysfunction was an operation. And the amount of operations we did was significant. The amount of operations we're doing now has really dropped off due to the advent of recent therapies. So what is erectile dysfunction? Erectile dysfunction is the inability to maintain or achieve an erection adequate for sexual performance. You hear it called ED, you call it impotence. Erectile dysfunction has become sort of the common phrase. Not so much it's politically correct, it's more scientifically accurate. It's funny, I tell people when you talk about erectile dysfunction, it's a situation that, people, they don't mind talking about their erectile dysfunctions. They don't want to talk about their impotence. And so I think that's, the news media and with, like I said, the Lettermans and the Lenos have made people have the ability to discuss this. It's funny when you talk to guys about this, some of them they want to talk about it. I can't tell you the number of guys that come to me, their wives want to talk about it. And so when I talk to them, I really like it if a guy brings his wife when we talk about his erectile dysfunction. Because I tell people, sex is a team sport, okay? When I talk to guys about their erections, I sort of say it this way. Think of your penis like a hydraulic pump. Blood rushes in faster than blood rushes out, and you get an erection. When we have problems with our pump, we just don't get the erections. People often ask me, what are the common things that cause erectile dysfunction? Well, it's very common, as you can see in men over the age of 40. I tell people they're what I call the big four for erectile dysfunction, okay? Number 1 is aging. Number 2 is smoking. Number 3 is diabetes. And number 4 is high blood pressure. And with high blood pressure, it goes sort of what I call it's the fifth, but it's the blood pressure medications, okay? A guy walks into my office, and he's 75 years old. He's been a diabetic for 20 years. He's on 4 antihypertensives, and his idea of exercising is walking down the store to buy 2 more packs of cigarettes, and he can't understand why he's having problems with erections. Okay, we need to talk here. I have guys all the time, which I tell them, they've had 4-vessel bypass, and they've had 2 bypass operations, and they're having problems. I said, look, the vessels in your penis are much smaller than the vessels in your heart, and when you start having problems up here, you're having problems elsewhere. And so it's a blood flow phenomenon. We can make your erections better. I tell people, expectations are 90% of what I do. If a guy comes to me for an operation for his kidney, for his penis, for whatever it is, if he thinks I'm going to make him 25 again, he's not. I think when you're realistic about your expectations treating erectile dysfunctions, then understand that. And so I think that's the thing that it has to be discussed when you discuss with patients. So like I said, these are the things: age, diabetes, hypertension, smoking. From time to time, the big thing that we're seeing now, guys have had radical prostatectomy or prostate cancer surgery or radiation. And I see a lot of men who have, if you start talking to them, a guy comes into my office and says, well, how are your erections? And he's a young guy. And you say, well, my wife just left me and I lost my job and my kids hate me. Well, okay, we have to back up a little bit. There's some other issues dealing with. And so there's a lot, it's a multifactorial thing. Can be hormonal. One of the things I always check on my men, you need to check a testosterone, and then you need to back out. Certain men that are on certain drugs, like some of the SSRIs for depressions, Prozac, Zoloft, Paxil, can cause erectile dysfunction. Okay? I think that, like I said, the expectations are what you really have to deal with when you talk to men. Like I said earlier, this sort of gives you an idea of sort of a diagram here. This is what, for example, this is what you're in the heart. This is kind of comparative to this size versus this size in your penis. So if this size is getting blocked off and you're needing to have 4 or 5 vessel bypass surgery, you can imagine that this one up here is already going to be obstructed. There are a lot of treatment options. I have to tell this to people, when Viagra came onto the market back in '98, it's been out for about 9 years now, it made a huge splash. Every man showed up in my office and he's thinking it's going to make him the new Wonder Man. It's not. I tell people this is a very interesting thing. Everybody has heard, if you were to go to most places, what is Viagra? Most people know what Levitra and Cialis are, but Viagra is by number one in the question. If you went to in the world, there's actually a study. There are 3 companies in this. If you go anywhere in the world, the number 3, 1, 2, and 3, and there's as far as branding. We're talking about branding. Ozarka. Okay. You know what the number 1 in the world is? Number 2. Very good. Coca-Cola is number 2. McDonald's is number 1, and Viagra is number 3. Isn't that amazing? Here's another little fact for you that most people don't realize. Until about 3 months ago, Viagra ran their first commercial, their first printed ad, saying what they did. Viagra is for the treatment of erectile dysfunction. Until that point, they had never said what they were for. They didn't have to. I mean, gosh, that's a marketer's dream. And the reason is when you say what you're for. If you say, I am XYZ and I am for, hair growth, you have to do what's called fair balance. You have to say what the side effects, even if they're small. And that's why when you see the Cialis and the Levitras, they talk about an erection lasting for more than 4 hours, which I have personally never seen. I've seen one case report. The sinus medications they talk about, whether it's Claritin or whatever, they spend more time telling you about the potential side effects than what they actually do. It's called fair balance. It's actually dictated to those what they have to say by the FDA. And so that has become a big deal. But be that as it may, the non-prescription medications, they work very well. Let me just sort of talk about those real briefly. These drugs are called PDE5 inhibitors. They work to give men better erections. Now, I tell guys, they're not going to make you have super erections. If a guy hadn't had an erection in 7 or 8 years, it's going to have a guy's a problem. The penis is just like your arm. People say, what do you mean? If you put your arm in a cast and you leave it in a cast and you never use it, when you take it out of that cast, it's going to be stiff and it's not going to work. Guys that haven't had erections in long periods of time are the most difficult men because that tissue that gets engorged with blood to give men erections gets scarred and fibrosed. The old analogy of use it or lose it is absolutely true. So a guy that walks into my office that hadn't had an erection in 10 years, that's a guy that's going to be a difficult problem to get his erections going again. These pills may not work. But what these pills do is they work to inhibit an enzyme to help the guy get better erections. I have to explain to guys, if you take this pill and just stare at your penis, nothing's going to happen. Okay? I can't tell you the number of guys that said, yeah, I took a Levitra, I took a Viagra, and I just watched my penis and nothing happened. Okay, we need to have a little education here. Part of the problem, and in their defense, are a lot of primary care doctors and family practice doctors, when they give this to patients, feel very uncomfortable. I have some of my partners who have no interest in talking about erectile dysfunction. Because when you talk about erectile dysfunction, you have to ask some very pointed questions. Some of them can make people a little uncomfortable, but you do. I mean, the guy that says, I see this quite often. I had a guy in my office. You have to ask them questions. Are you in a relationship? When was the last time you had an erection? Can you get it? When did you have an erection? Do you ever have an erection? No. What do you take? You start to ask questions like that. My wife left me 3 years ago. Okay, there we have to back up and sort of readjust. And so I think it's you have to ask some very pointed questions, and you have to kind of tease through all the stuff. But you take the pill. It takes about an hour to be effective, and it basically takes some sexual stimulation, some foreplay. People say, what are the difference between the 3? They're basically all the same. They all work effectively. The big difference I think that a lot of people will discuss, and I have personal preferences we discuss, is the Cialis. One of the things I like about the Cialis, it has a 36-hour half-life. And that means it has 36 hours of efficacy. Now, first of all, you're not going to have an erection for 36 hours. But what it does is it gives guys a sort of a broader window of opportunity, if you will. But for me to stand here or for any rep or any company to say, hey, we work better, we give better erections, they're blowing smoke. Okay? They all work well, they're all safe, they're all effective. Every person, and it's like I tell some people Advil works well for, some people Aleve or Tylenol works. You kind of have to sort of move around and see what works best for those patients. If a patient comes to my office, and that's usually my first-line therapy or the oral medication. If that doesn't work, we move to vacuum erection devices or what we call injection therapy. Basically, vacuum erection device is a clear plastic cylinder, has a little rubber band at the base that you put over the penis. It's got a little hand pump that you pump, pulls the blood like a little suction cup into and the little rubber band fits around the base of the penis. A lot of guys don't like it. It is a little mechanical, have some numbness to the penis, and it's a dealer's choice. And then injection therapy. We actually teach you to give yourself a shot. And now, most men sort of cringe when I say this, okay? We teach you to give yourself an injection into the penis, okay? If you think of my fingers being the penis, you actually give it on the side of the penis. Now, most men are like, I'm